ADHD, or Attention Deficit Hyperactivity Disorder, is a common neurodevelopmental disorder that begins in childhood and often continues into adulthood. ADHD is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with daily functioning and development. While it is normal for everyone to occasionally struggle with focus or restlessness, individuals with ADHD experience these symptoms more severely and consistently, leading to significant challenges at school, work, home, and in social relationships. There are three main types of ADHD. The first is predominantly inattentive ADHD, where individuals have significant difficulties with paying attention, organizing tasks, following instructions, and are easily distracted. The second type is predominantly hyperactive impulsive ADHD, which is marked by a constant need to move, inability to stay seated, excessive talking, and impulsive actions without considering potential consequences. The third type is combined ADHD, which features a mixture of inattentive and hyperactive impulsive symptoms and is the most common form. ADHD screening, also known as ADHD testing, is the process used to determine whether a child, teen, or adult has ADHD. The screening is designed for individuals who frequently have serious problems with attention, hyperactivity, and/or impulsive behavior. In addition to evaluating for ADHD, the screening process often checks for other mental health disorders that can occur alongside or be mistaken for ADHD. The need for screening can arise when parents, teachers, or caregivers notice persistent symptoms in a child, or when adults reflect on lifelong struggles with focus, organization, impulsivity, or restlessness that began before the age of 12. Some of the hallmark symptoms that may warrant ADHD screening include frequent careless mistakes in school or work, trouble sustaining attention on tasks, not listening when spoken to directly, difficulty following through on instructions, poor organization, avoidance of tasks requiring mental effort, losing important items, and being forgetful in daily activities. On the hyperactivity impulsivity spectrum, symptoms include fidgeting, restlessness, inability to stay seated when expected, inappropriate running or climbing in children, constant movement or feeling on the go, excessive talking, blurting out answers before questions are finished, difficulty waiting for turns, and frequent interruptions during conversations or games. Those with combined ADHD will present with symptoms from both categories. The ADHD screening process is comprehensive and involves several steps to ensure an accurate diagnosis. There is no single definitive test for ADHD. Instead, healthcare providers follow established clinical guidelines that involve gathering information from multiple sources, conducting standardized assessments, and ruling out other conditions that may present with similar symptoms. The screening generally begins with a physical examination. This step is essential to check for other medical conditions that could be causing the symptoms. For example, vision and hearing problems, thyroid dysfunction, or other health issues can sometimes mimic ADHD symptoms, so these need to be evaluated and excluded. The next step involves a thorough review of the individual's medical history, family health history, and any relevant records, such as school reports or previous assessments. ADHD often runs in families, so a family history of the disorder can provide important context. For adults, providers may look at old school records to determine if symptoms were present in childhood, which is a key criterion for ADHD diagnosis. A critical part of the screening process is the use of standardized ADHD symptom checklists, rating scales, questionnaires, and structured interviews. These tools help healthcare professionals systematically evaluate the presence and severity of symptoms. The individual being evaluated is interviewed about their symptoms, and for children, parents are typically involved in the discussion. To gain a comprehensive view of how symptoms manifest in different settings, information is also gathered from other people in the individual's life. For children and teens, this might include teachers, babysitters, coaches, or family members who observe the child in various situations. Parents may be asked to complete checklists or questionnaires as well. These multi-informant assessments are important because ADHD symptoms must be present in more than one environment, for example, at home and at school, to meet diagnostic criteria. Gathering insights from different sources helps ensure the symptoms are not situational or due to other factors. In summary, ADHD is a complex disorder that significantly affects attention, activity levels, and impulse control. It can present as predominantly inattentive, predominantly hyperactive impulsive, or a combination of both. Its symptoms often begin in childhood, but can go unrecognized until adolescence or adulthood. The impact of ADHD can be profound, leading to academic, occupational, and social difficulties if not properly identified and managed. ADHD screening is an essential process for individuals who exhibit persistent symptoms of inattention, hyperactivity, or impulsivity that interfere with their daily life. The screening process is thorough and involves a combination of physical exams, medical history reviews, standardized symptom assessments, and gathering information from multiple sources to ensure a comprehensive evaluation. This approach helps differentiate ADHD from other conditions with similar symptoms and guides appropriate treatment. Once a diagnosis is made, treatment options are available to support individuals with ADHD across the lifespan. These may include behavioral therapies, medication, educational interventions, and lifestyle modifications. Early identification and intervention are key to improving outcomes and helping individuals with ADHD reach their full potential. For anyone concerned about symptoms suggestive of ADHD in themselves or their children, it is important to seek evaluation from a qualified healthcare provider. A proper diagnosis is the first step toward understanding the challenges faced and accessing effective support and treatment. As our understanding of ADHD continues to grow, so too do the resources and strategies available to help those living with this condition thrive.